Well, we're back with Dr. Davidhizar from Alaska. Dr. Davidhizar, you're an MD, a family practitioner, and you see all these things for which, normal people come when they have a sniffle, pain, this and that, when they, want to have a checkup for blood pressure, name it. But at the same token, you're very specialized in pain, back pain, knee pain, and all those things. Let's talk about lower back pain and tell us, because some people are rather in apathy about it. They have it for a while, they've tried all kinds of things and things don't work. Give us a little insight of what should be done and what you can do for people with back pain.
Well, there's multiple causes for back pain. It can be from a ruptured disc, it can be from arthritis, it can be from a sacroiliac joint that's out of place or that's been injured. So the first thing to do is sort of determine where the pain's coming from, what the source is. Once we know the source, then it's much easier to treat it. So sometimes it involves getting an MRI to get a good look at the discs, make sure that's not the problem. We can also get MRIs of all the joints. But just by examination, by palpating the patient's back, finding out where the pain is, what the distribution of pain is, we can pretty much tell clinically what the problem is. Not always. Sometimes we need to use some supporting documentation with other x-rays or MRIs. But usually just with an examination, you have a pretty good idea what the problem is. Once we have that narrowed down, then there's multiple ways to treat that problem. You discuss those with the patient, see what they think they prefer, and then we can move forward.
Okay. Tell us a couple, 2 or 3, rather maybe newer type of development of treatments or treatments which very often do the trick, even though there is no 100%, I understand. But give us a couple of examples of how people could be treated.
Well, for low back pain, I'm an osteopathic physician, so frequently we'll manipulate their low back, depending what the problem is. That usually helps considerably. The other thing is we do injections. A lot of people have trouble with sacroiliac joints, and those are very easy to inject. We use a combination of 3 different medications together. One of them is an anesthetic, so they get usually complete relief fairly quickly after the injection. That slowly wears off, but then the anti-inflammatory drugs that we use slowly work. Frequently that works for years for people. Sometimes they need it re-injected again. There's also physical therapy that we sometimes recommend.
Let me interrupt you for a second here. Are you telling me that one of those treatment injections is like a one injection, and it kind of lasts for a year or more before it wears off? Or is it
frequently?
So it's not that a person has to come every few weeks for a year or so. It's just one set of treatment, and he is frequently pain-free for years to come.
That's true.
Wow.
It just depends on the individual and how bad the problem is. Some of the other injections we do, like epidurals, that actually requires usually 3 injections to get maximum results. But that sometimes will last years too. And then sometimes it's much less. It depends on the individual.
Sure. And those 3 injections, I assume they'll be giving over, not necessarily in one shot, but like one every couple, 2-3 weeks or whatever?
For the epidurals, I do them once a week for 3 weeks in a row. Even if the patients don't get much relief from the first one, you can still get relief from the other 2. So, and some people get great relief from the first one and say they don't think they need any more. But you get the best results long term if we do all 3 of the injections. So usually I try to convince people to just do all 3 of them, regardless of what the results are with the first 1 or 2.
Right. Well, I mean, that makes a lot of sense because, it doesn't matter how half you do a job, it is half done. You gotta, imagine a surgeon taking out your appendix and say, hey, I don't like it so far, I want you to stop and not sew it up anymore now. That wouldn't work so well, you gotta go through the whole thing. Now let me ask you, what's the, give me the big difference between I know you mentioned the names of your injections, but to most of us those are names we might hear and understand while you say it, but then we have really no clue. What is the difference between those type of injections you're giving, which gets a pain-free for years sometimes, versus painkillers injections or painkillers period? What's the difference?
Well, the painkillers, of course, just cover up the problem. They don't really fix the problem, whereas the injections frequently will fix the problem for long term. That doesn't mean it won't ever come back again, but we hope that's the case, but frequently if the patient goes out and does something again, they try to lift too much weight or those sort of things, they could re-injure it and they could have the problem back again. The key is, once the pain's gone, to strengthen those muscles so that they won't re-injure them so easily again. You asked about the different type of injections. The epidural injection that we talked about earlier is actually injection into the space right around the spinal column. That's where the nerves come out of the spinal column and go into your leg, and frequently they are swollen and inflamed because you've got a ruptured disc or a disc particle pushing against that nerve. Well, when you inject medicine into that canal, the anti-inflammatory shrinks down that nerve so that it takes the pressure off of it and the pain is relieved. So that's an epidural injection. The other ones we're talking about, like sacroiliac, that's your sacroiliac joint. That's where your pelvis and your sacrum come together, the lower part of your spine. It's a big, long joint. It's probably 6-8 inches long, and that frequently has problems because it takes a lot of wear and tear and when you're doing things, because it moves. A lot of people will twist wrong and get that inflamed. So injection to that site is frequently cures people for a long, long time, for years. I had one guy come back actually 6 years after an injection and said it wore off. He wanted to re-inject it now. So that injection works extremely well for lots of people. We've had a lot of success with that, but so does the epidural. We also do facet blocks, which is a joint that's right next to your vertebra that frequently has some arthritis in it or is inflamed from an injury, and those are very successful too.
Now tell me, injections in the back. Obviously, I would, from talking to you now, I would prefer the type of injections you give rather than the injections which are pure painkillers, because it just makes a lot more sense. But injection is an injection. So tell me, does that stuff hurt? I mean, is that like one of those things where you go to the moon before you get better?
No. Well, they're shots, so they're not painless, but with the shots, we always inject as an anesthetic with it. So almost usually before I even get the needle pulled out, most people are saying, well, pain's gone already. I don't feel it, because we're getting to the underlying problem. But it's a shot. When the needle starts in, you're going to have a little pain at first, but usually before we get done with the injection or soon after, the pain's gone. Okay.
So no need to arrive at your office with a bottle of scotch in the stomach in order to endure the pain?
No. Or no silver bullets either.
No, oh, okay. Well, all right. Well, look, Dr. Davidhizar, very informative, and I appreciate your candidness. Definitely very, very informative. I'm sure that will make lots of people realize that get off the painkiller. Would you suggest that that's a good thing versus what you do?
Yes. We use painkillers too, of course. We don't want anybody to have to suffer needlessly, but
right.
The whole idea is to fix the problem, not just cover it up with painkillers.
Right.
So sometimes we have to use those for a while until we get things under control.
Well, it's like having a major toothache. It's okay to take a painkiller or even get an injection to get rid of it, but then you've got to fix that tooth. If you just keep taking painkillers, that tooth eventually will definitely give you major problem, because it's still, the infection in it still grows, right? And so that's a similar thing. You give a painkiller, deal with the other treatment, you get rid of the source of the pain.
True.
Wonderful. Thanks a lot.
You're welcome.